Hi, I'm Claudia. Today I'm going to explain about one of the cytochemical stains in hematology, which is the leukocyte alkaline phosphatase, or we call it as LAP. So first I'm going to explain about the definition of cytochemistry. Cytochemistry is study of the chemical elements of the cell. It is used to detect chemical components or elements which may be enzymatic or non-enzymatic in nature, such as enzyme, fat, or lipoprotein. Now, we will look into the cytochemical stains. Cytochemical stains are the special stains that can be performed on peripheral blood smears and bone marrow smears. Cytochemical stains are enzymatic colorimetric reactions that occur in the cells of interest and are important in the diagnosis of leukemia. Besides, the purposes of cytochemical staining are: first, to assign and confirm myeloid and lymphoid lineage, to confirm the diagnosis of hairy cell leukemia, to differentiate between leukemoid reaction and chronic myelogenous leukemia, or CML, which we will look into more later, to differentiate and classify leukemias, to detect cytoplasmic abnormalities and enzyme deficiencies in myeloid disorders. Alright, so we will now focus more on leukocyte alkaline phosphatase test. So, alkaline phosphatase is an enzyme that presents in all tissues, especially in bone, liver, kidney, hepatobiliary system, and placenta. But in leukocyte alkaline phosphatase test, we are measuring specific enzyme, which is the leukocyte alkaline phosphatase. So it is an enzyme that is situated in the tertiary or microvesicular granules of segmented and band-formed neutrophilic granulocytes or neutrophil. So the enzyme activity will increase as the white blood cell matures. So the aim of ALP test is to demonstrate alkaline phosphatase enzyme in the cytoplasm membrane component of segmented and band-formed neutrophils. And the purpose of ALP test is to differentiate between the leukemoid reaction and chronic myeloid leukemia. The principle of leukocyte alkaline phosphatase test is based on the diazotization coupling principle. The substrate, which is naphthol phosphate, is hydrolyzed by alkaline phosphatase, releasing naphthol. Naphthol immediately couples with the diazotized amine, which then form an insoluble and visible pigments at the sites of the phosphatase activity. The higher the amount of alkaline phosphatase contained in the white blood cell or neutrophil, the stronger will be the intensity of color shown. Okay, so now the specimen that can be used in the leukocyte alkaline phosphatase test is that we can use fresh heparinized blood sample. We also can use the blood from a finger prick. The peripheral blood film must be stained within the period of 5 to 6 hours. However, if blood is collected in EDTA tube, the staining must be performed within the period of 1 hour. It is advisable also to not use EDTA tube for sample collection because EDTA will interrupt leukocyte alkaline phosphatase activity. So now we are going to look into the staining technique. So what are the reagents that are needed for the staining technique of LAP? So for the fixed active, we can use 10% formalin methanol. For the substrate, we can use sodium naphthyl phosphate. Buffer, we can use propanediol buffer. And for the coupling azo dye, we can use fast blue RR salt. For the counterstain, can use 2% methyl green. And we can prepare also the working substrate solution by dissolving sodium naphthyl phosphate together with fast blue RR salt and working buffer solution. Alright, so we can now look into the staining technique. So first, fix air-dried peripheral blood films for 60 seconds with 10% formalin methanol at 0 to 4 degrees Celsius. Then we wash it in running water for 60 seconds and air dry. After that, can prepare the working substrate solution, which is explained previously in the reagent part. Can mix it well and filter it onto the peripheral blood film using Wetman number 41 filter paper. Then wait for 5 to 10 minutes. After that, we rinse the peripheral blood film with tap water for 10 to 20 seconds. Then we counterstand in 2% methyl green and rinse with water and air dry. Last but not least, evaluate the film microscopically within few hours after the staining procedure, because the staining will fade away. Okay, so for the control that we can use in LAP test is are two. There are positive control and negative control. So now first we will look into the positive control. So the LAP score usually exceeds more than 100. So for the positive control, we can obtain it from patients with pyogenic leukocytosis or women in the third trimester of pregnancy or during the first several days postpartum. And for the negative control, we can prepare it from a normal fixed smear by immersing it in boiling water for 1 minute to inactivate the enzyme. Okay, so now we will look into the precaution that need to be taken during the LAP staining. So first, we must always be reminded to use fresh and thin smears of peripheral blood film because thick smear will give falsely elevated result. And if the staining will be delayed, we must fix the slide within 2 hours after blood collection and store it at -20 degrees Celsius. We must also remember to use the right blood tube or anticoagulant tube for specimen collection, such as heparin tube. Avoid using EDTA because, as explained earlier, EDTA will interrupt alkaline phosphatase activity. Besides, we must also ensure that the staining procedure of the peripheral blood film is done in an area that is protected from direct light. So for the result is shown in LAP score. So the LAP scoring is done by selecting 100 consecutive segmented and band form neutrophils. So must remember that segmented and band form neutrophils only is to be observed. And then we rate from 0 to 4 plus on the basis of quantity and intensity of precipitated dye within the cytoplasm of these cells. So the character of scoring is shown as in the table below. So we can see here, when there are no granules, we can rate it as 0. When there are very few to few non-clumping single blue granules, we rate it as 1 plus. When there are few to moderate numbers of granules in the white blood cell, we rate it as 2 plus. While for the 3 plus, we rate it when we see there are moderate to numerous granules in the cells. And when the cells is filled with the granules, the cytoplasm of the neutrophil is filled with the granules, we rate it as 4 plus. Alright, so now we are going to see some of the pictures of the result of LAP test. So this one, we can see the result of 1 plus to 4 plus. So for 1 plus, you can see there are single granules present, that the color is really weak, and for 2 plus there are few blue granules present. For the 3 plus, we can see it is stronger and we can see a clumping of blue granule here. And for the 4 plus, it shows stronger and strongest blue color compared to the previous 3 neutrophils here. And then now we are going to look in the next picture. Here we can see 2 circle neutrophils, one with a score of 0, which means there are no blue granules present, which also then define that there are no leukocyte alkaline phosphatase activity present in the neutrophil. While here we can see score of 4+, which means there are high color intensity of blue color, and then there are high leukocyte alkaline phosphatase activity here. Okay, so here it is the score of 1 until 4. So you can see that number 1, number 2, number 3, and number 4. So here is the neutrophil with score of 3+ and 4+. You can see stronger color here in 4+ neutrophil, which means there are really high amount of leukocyte alkaline phosphatase activity here. Alright, so for the interpretation, the normal range of LAP score is 15 to 100, while the score for baby is 150 to 300, and LAP score for women and children is higher compared to men. So for the low LAP score, which is less than 15, is often found in patients with chronic myelogenous leukemia, CML, paroxysmal nocturnal hemoglobinuria, PNH, sickle cell anemia, sideroblastic anemia. For the high LAP score, which is more than 100, it is found in patients with leukocyte reaction, myeloproliferative disorders, for example, polycythemia vera and myelofibrosis. Third trimester of pregnancy, multiple myeloma, Hodgkin's disease. Alright, so we will now see about leukocyte reaction and CML. So we will come back to the purpose of the leukocyte alkaline phosphatase test. It is actually to differentiate between leukocyte reaction and chronic myelogenous leukemia. So here in this table, we can see that for both diseases, the white blood cell count and neutrophil count is high, but the difference between these two is the LAP score. High LAP score is found in leukocyte reaction because it contains many alkaline phosphatase, while low LAP score is found in CML because it contains less alkaline phosphatase. So here I will further explain about the difference of LAP score between CML and leukocyte reaction. It is closely related to the fact that in humans, alkaline phosphatase activity is restricted to mature and band-formed granulocytes or neutrophil. Leukocyte alkaline phosphatase is involved in the digestion of phagocytosed material in neutrophils. Therefore, mature neutrophils have higher digestion capacity to fight infection. So now we see that both CML and leukocyte reaction have high white blood cell count. But the difference here is that in CML, the white blood cells produced are abnormal and less mature, because the white blood cells in leukemia can replicate but are unable to differentiate. Therefore, less mature neutrophils have low alkaline phosphatase activity and are defective in fighting infection. Neutrophils in CML do not uptake the stent for alkaline phosphatase into the cytoplasm, so this is the reason why there is low LAP score in CML disease. Now, we will look into the leukocyte reaction. The white blood cells produced in the leukocyte reaction by the bone marrow are normal and mature. So, mature neutrophils hence have high alkaline phosphatase activity and great digestion capacity to fight infection. So it means that they are capable and they are normal neutrophils. So neutrophils produced in the leukocyte reaction uptake the stent for alkaline phosphatase into the cytoplasm. This is why leukocyte reaction has high LAP score. That's all about leukocyte alkaline phosphatase activity. That's all is about the leukocyte alkaline phosphatase test. Thank you so much.